Welcome to OTW Spotlight. I'm TJ Halverson, and today we're diving into a technology that's advancing the paradigm of skin regeneration and SSI reduction with a fully synthetic antimicrobial matrix that's made of bioresorbable polymers. I'm joined by Brad Wiggins from Imbed Biosciences, as well as Dr. Karen Nelson from the University of Southern Nevada. Thank you both for joining us today.
Thank you so much for having us.
Thanks for having us, TJ.
Absolutely. I'm excited to dive into this. And Dr. Nelson, we have a lot of questions and clinical applications we're going to dive into a little later. But Brad, I think it's important that we set the stage. So for our audience that's not familiar with what you do, why don't you give us the foundation? Who is Imbed? What's the problem you're solving in the orthopedic space?
TJ, thank you for the opportunity to talk about Embed Biosciences. Embed is really working to change the paradigm of wound care with a revolutionary SAM platform technology that integrates multiple wound care agents into kind of an ultra thin, fully synthetic matrix composed of bioabsorbable fibers. It's designed to help protect wounds and facilitate wound healing. And we have a full portfolio of different types of products that we're going to cover today through this conversation.
Yeah. Yeah, no, that's really it's exciting. We're going to dive into a lot. And, here's one thing that I wanted to start with. One of the first times I saw this product, it's like, oh, it looks like a silver dressing, but you're not addressing it all. So why don't you explain a little bit more of the distinction that's important for orthopedic surgeons to understand?
Yeah, I appreciate that opportunity also. One of the things that we also really feel is the main benefit of this is the way that it conforms down into the wound bed. It's bioabsorbable. It's a polyvinyl alcohol. And I
Hmm.
think it's very unique from other things that providers have actually had access to. For them to be able to use this technology is something that they're going to find is the kind of that next generation change within management for SSI reduction. And I
Hmm.
think our goal is to help get to zero. And I think that Dr. Nilsson's going to highlight some of the successes that she's had using this
Hmm.
technology and the way that it conforms into the vet for best outcome.
Hmm. Hmm. Yeah, very, very interesting. So let's break down, since we're focused on Academy coming up in a few weeks. Why don't we talk a little bit about how Surgaflex in particular fits into the orthopedic practice? We've identified a couple different applications for today's discussion: orthopedic trauma, managing a dehisced wound, and also this insurance policy, so to speak, to reduce SSIs. So why don't we start with orthopedic trauma applications? How does the pain guard technology that you have as lidocaine factor into the trauma cases, and why should an ortho surgeon care about that localized pain management that you're providing at the wound site?
Yeah, I love that question, TJ, and to kind of develop it a little bit more from your previous question of how
Hmm.
does it compare to a dressing? Well, you
Yeah.
change a dressing, right? So you have a
Hmm.
material here, like I said, that's bioabsorbable. So I think that that's the part that an orthopedic trauma provider needs to understand is that we have a technology, it has the silver within it, the 1 part per million, and we've also added lidocaine so that you're going to get the benefit of giving your patient pain reduction opportunities. And I think that's a really nice piece to be able to offer that hasn't really existed before. There's a lot of different
Hmm.
tools and techniques that are used, and I'm sure Dr. Nelson will highlight some of those within her practice as we talk with her later. But us having a product that, again, bioabsorbs, that contains both the silver and the lidocaine piece is going to make a huge difference to be able to help with pain reduction. And we hope that those providers and those patients are ultimately going to see that they don't have to use as many narcotics. Narcotics play a huge role in a lot of negative outcomes for patients, and
Hmm.
narcotic reduction is obviously kind of the name of the game. Pain
Yeah.
management being a really big piece of that. So that's
Hmm.
the first piece is those orthopedic trauma applications. We also think about the idea of helping to provide management of a dehisced wound. So many of these providers actually see wounds in the clinic setting or in the operating room setting where they're expected to manage a wound that's actually dehisced. So SAM
Mhm.
can play a very important role in helping to clean up that wound bed and be able to manage those types of issues as well. We also like to view our product as something more of an insurance policy to help to reduce those SSIs.
Mhm.
We wouldn't say that we manage an infection, but what we would say is that we're giving you a tool to help to prevent infections inside that patient's wound.
Mhm. Mhm. So, is that specific to high risk closures that they think there might be a problem? There tends to be more issues with this type of procedure or this patient population. Why do you think that specific approach is gaining traction?
Yeah, I think it's really gaining traction in lots of different types of communities, primarily in that of trauma, because patients, when they have an open fracture or they have an open injury so much, they obviously, their body and their tissues are exposed to a lot of different types of environmental risks that promote
Hmm.
those moments for infection. So I think that
Yeah.
that's a big piece. Our friends at Norton Healthcare recently completed a 100 patient study that
Mm.
followed up to a 22 patient study that was previously done in wounds that demonstrated 0% SSIs in high risk surgery patients treated with the SAM technology. So I think that that's a really important component to realize is that that 100 patient study, when people get to see it, focused actually on placement with all sorts of different type of orthopedic injuries, both of hips and joints, hip joint replacement, as well as knee replacement surgeries.
Mm.
And they found really low SSI rates in all those types of cases. So I think those
Mhm.
are the types of things that we really like to highlight for providers and to make them understand that listen, these are game changing moments and they're making a huge difference for outcome with these patients.
Yeah. Yeah, absolutely. Well, it's great information, a lot of application opportunities. And we've already mentioned Dr. Nelson a few times, welcomed her in. So now let's bring Dr. Nelson into the conversation, hear directly from her how she's using Surgaflex and what made you decide to incorporate it into your practice.
So I was first introduced to Surgaflex about 2.5 years ago. And my rep came up to me and said, "Hey, I have this silver material, and I think you might like it for your, open fractures or, contaminated wounds." And I
Mhm.
got really excited because I have a microbiology background. So surgical site infections, wound prevention or infection prevention is like of a huge interest to me. When I was a medical student, I thought I was going to change medicine by developing a silver impregnated suture. And I was really disappointed when my husband, who is a plastic surgeon, said, "That's already been done." And it didn't really work. Um, so, fast forward a few years later, and, my rep comes up to me with this product, and again, I was so excited. So I started placing it in basically all of my open fractures, anyone who came in with a chronic infection, anyone who is high risk. So,
Mhm.
obesity, diabetes, vascular disease, anyone who is immunocompromised. And I've had really, great outcomes so far, and I've been really happy with
Mhm.
the product.
Yeah. Tell us a little bit more about your practice. Help us get set the stage for how many patients you see that can be treated with this type of technology.
So, I'm in an academic practice at a level one trauma center. And so, as a tertiary referral center, we tend to see some of the most complicated disaster patients coming through the door. And so, for me, it's been a lifesaver. Surgical wounds
Mhm.
and wound infections is a huge part of an orthopedic trauma practice. And so, anything we can do to minimize that has been really helpful.
So, Dr. Nelson, it seems like you've treated hundreds of patients now with Surgaflex. Can you walk us through any specific case where you used it as this insurance policy? And what did the outcome look like?
Yeah, so this, I'd like to highlight a few of my cases. So this first case here is a 39-year-old man who was dragged by a semi truck. and basically sustained this entire leg degloving with a open comminuted tibial plateau fracture and distal femur fracture. And one of my partners walked by the trauma operating room while I was doing this case and said, that leg needs to go. And I said, no, we're going to try and save the leg. And so obviously the first thing that comes to mind when I see something like this is infection. How do we prevent this guy from getting an infection? And
Hmm.
so something like this, I'll take back to the operating room for serial debridements. And I can't remember exactly how many times we went back with this particular case, but each time we took him back to the OR, we laid the sheets of Surgaflex on top of the wound, and then covered it with either a dressing or a wound vac. And we were able to save his leg. I took him
Wow.
back for one potential infection, but it wasn't really an infection. It was one of my screws had backed out and was poking through the skin.
Hmm.
But again, really happy with his outcome. He was able to save his leg. He's able to walk around. This is a patient who I didn't think would have access to getting a prosthetic. He's a little bit
Hmm.
unreliable, and so again, really happy we were able to save his leg and that he can walk around without a prosthetic.
That's incredible. Wow. So when you're looking at some of these high risk orthopedic procedures, and it could just be a patient with diabetes, it could be obesity, some of these other complicating factors, or huge trauma. How does your use of SAM factor into the surgical planning?
So immediately when I see one of these cases and I know I'm going to take them to the operating room, my
Hmm.
first thing that I do is I either call my rep or tell the circulating nurse, make sure Listerine is ready to go, um, or, or Pellet Shield or Surgaflex. We tend to call it different things all the time, but
Hmm.
I want to make sure that I don't forget that it has become just as important as having saline in the room and having
Hmm.
proper medical equipment. It's a
Hmm.
huge part of my practice now.
Yeah. Yeah.
Okay, so another interesting case, and some people will say, children, well, they're stem cell factories, they're going to heal anyways. But I thought his was a little bit more complicated. So this is a 15-year-old boy. He was involved in a motorcycle collision, going 35 miles an hour and T-boned by a car, and he had
Hmm.
multiple orthopedic injuries. But this particular one was a knee degloving injury with an open patella fracture. And I attempted to tack down the skin. But prior to tacking down the skin, I placed the Surgaflex and then closed the skin. And then I actually placed the Surgaflex on top as well. And you
Hmm.
can see in the pictures here that his wound, the central portion of that wound, became necrotic. But again, it didn't look infected to me. So I consulted our plastic surgeon who recommended a skin graft, and the family said, no, we don't want to have a skin graft. So we just chose to watch the wound, and he was able to granulate in. And currently, he is essentially almost healed. At this point, he's 8 months out from his injury. The nice thing, too, about not having to go through the skin grafting is he was able to rehab without keeping his legs straight. He has good functional outcome, and his wound has since healed. And, again, the family has been so grateful and so happy that we didn't have to do the skin grafting.
Yeah. Yeah, that's huge. So, as someone who practices at an academic medical center, how do you see Surgiflex fitting into the broader conversation about SSI prevention and improved surgical protocols?
So, at an academic center and a level one trauma facility, we see kind of the highest risk patients, the worst of the worst patients that are typically referred to us or sent to us. And so it is, infection is always on my mind. And so Surgiflex has become a huge part of my practice. Anytime I see open fractures or high risk patients, I'm making sure that Surgiflex is available for my
Hmm.
my case. So this is a patient of mine, a 79-year-old man who came in with an infected vascular graft and a draining sinus in his leg. And this had been going on for several years. I think his operation was performed 20 years ago. And this is a video of me applying the Surgiflex into the wound bed. And you can see how I'm using this dry lap sponge. If you're using it with
Mhm.
wet hands or wet instruments, it tends to stick to you. So I'll use the dry lap and lay it in the wound bed and then remove the sponge. And you can see how it conforms really nicely to that wound
Yeah.
bed. Really easy to use. This
Mhm.
was him actually. I meant to send you the follow up picture. This was him right before surgery, and then I had excised the wound track, and his wound has completely healed, and that pain that he had is gone now in his thigh.
Wow. That's pretty pretty incredible. So, are there any other cases or specific examples that you might want to share with us before we talk about some of the other products and competitive advantages that Sam has in the space?
Yeah, so this was a 36-year-old male. He was, I believe, in Lake Mojave boating accident, and the propeller
Mm,
caught the front of his leg. He sustained a extensor mechanism injury to his patellar tendon, tibial plateau, and tibial shaft fracture. So obviously, grossly contaminated open fracture that was originally treated at another facility and then transferred to me. And he underwent a gastroc flap, but again, they never really thoroughly debrided him. He was contaminated, and so I took him back to the operating room because they hadn't definitively fixed him and really thoroughly debrided him, fixed his extensor mechanism. Nailed his tibia, and before I closed him, I placed the Surgaflex again in the wound bed, closed him up, and then placed it again on top of the wound. And
mhm,
he has had a fantastic outcome. I thought for sure because he grew out multiple different types of organisms from his wound, obviously being in a contaminated lake. And he has had, I believe he is 5 months or 6 months from his injury and now has been able to heal with no complications and using his leg normally.
that's great. Well, thanks for sharing all those examples with us. Really, some great results. And at this point, I think let's re-engage Brad here. There's a lot of other products in this space. There's powders, there's other antimicrobial solutions, and others are also now moving into the implantable space. So, for surgeons that are evaluating their options, how do you position Sam's competitive advantage? Why should they choose you?
Yeah, I think our competitive advantage starts with its ease of use. It's
Mhm.
incredibly easy to use. As Dr. Nilsson's highlighted, it's a simple material that's easy to get to attach down into the wound bed. It activates as soon as it makes contact with the wound. As you've seen earlier in the intro, we've demonstrated how it conforms into those matrices of the wound bed, which is amazing and different in anything that you've seen. My long-term experience with managing these types of situations has always been something that you could sprinkle into a wound, or you could put a dressing in it, or you could
Mhm.
do something along those lines. I think that from a price point of view, I think that's always something that everyone's concerned about, is that we are very cost beneficial to these types of situations. We know that we have the ability with the silver technology, just that simple 1 part per million in the way it conforms, to battle different types of bacteria. We're good against gram negative, we're good against gram positive, we're good against fungus, and ultimately we don't have any taper off with that silver. We know
Mhm.
that it immediately activates, and it's good for 72 hours of activation, is what we have to say from an FDA standpoint. But I also would highlight that we know we have long-term efficacy with
Mhm.
that microbial battle. And I think that that
Yeah.
first 72 hours when you close up that wound is when the wound's most at risk for those types of infections. And I really think that those competitive advantages is what set the difference for, as an example, Dr. Nilsson's highlighted. She's seen a huge difference in the way that she applies these products. She's seen a difference in the outcomes of her patients. And it's become such a simple, it's become the standard of care for her inside her operating room when she's managing these types of things. So
Mhm.
I'd love for her to comment a little bit about what she sees as some of the challenges within that space as well. I think talking to the professional that's doing it might be very beneficial.
Absolutely.
Yeah, so one of my favorite things about this product is that There's so many different products out there on the market. Again, my husband being a plastic surgeon, we talk about wounds and, wound product all the time. And, we're like, what slop du jour are they going to talk to us about today? And this is pure. It's just silver. And you're not trying to convince me that this is the best, highest quality collagen, bovine collagen, porcine collagen. I don't have to worry about, an adverse reaction to the product. I don't have to worry about potentially consenting my patient for this product. And again, you're not trying to sell me on there's so many live cells and trying to prove something
Hmm.
to me. The product speaks for itself, and silver again has been around for so long. It's reliable.
Yeah. Yeah. No, that's great. It's great. And it kind of plays into, Brad, what you guys have just started to promote a little bit more of this getting to zero, right? We're, everyone is focused on SSI prevention. And that's where you guys are really able to, know, bring in the benefits and the data and the long-term effects that you're now providing with Surgaflex. So can you talk a little bit more about that whole mission around getting to zero and how you see that affecting the greater surgical community and patients?
Yeah, I think that out of everything, that's always the takeaway is patient focused, TJ.
Hmm.
As a longtime nurse and dealing with different providers, everyone's goal is for best patient outcome and best patient delivery. Nobody wants their patient to have a surgical site infection. It's really become something that's a complication. It adds to increased length of stay. It could potentially add to, the risk of very large comorbidity issues or even a mortality. So those are things that I think we want to pay attention to when we're thinking about terminology, SSI. Uh, in my conversation with surgeons, surgeons often say, when I'm closing, I have a feeling and I know just based off of what I'm seeing whether this patient is at risk. They've had to take him to surgery. They've had to manage the wound, and I think whether or not you're dealing with it from a trauma ortho side or you're doing it from a controlled, joint replacement type of side, when you see the tissues, when you're inside there, whether there's going to be a chance that this might be coming back around with an opening. That's those are the things to consider. And I think that those are the moments to pay attention to within the care algorithm. If that's when you know that you need that support of that antimicrobial silver efficacy. That's when you know you're making a difference in being able to get that wound closed, keep it closed, and having really lovely outcomes when it comes to not seeing those SSIs. So that goal of SSI is something that everybody wants. And I think in this situation, particularly within the ortho complexities of the types of things that different providers see, it's just a simple alternative to giving yourself the goal of zero and getting to
Hmm.
zero. And I think those things will make a huge difference with providers that give it an opportunity.
In the orthopedic community, regardless of subspecialty, the goal is always to decrease or eliminate surgical site infections. And so, one way that trauma surgeons have been trying to do this is there was some data that came out about sprinkling vancomycin powder inside the wound bed. Well, everyone thought that was a great idea, so we all started doing it. And what we found was that we started selecting out for gram negative organisms. So then we started sprinkling vancomycin and gentamicin in the wound, and we found that we were causing kidney injury by doing that. And now we're finding that it really has no difference if we put the antibiotics in or not. And there were some other adverse outcomes too. It caused wound drainage. And, we thought if 1 gram was good, then 5 grams is better. So now we're trying to get the pharmacy to approve multiple vials of these expensive antibiotics. And so it's really nice now that I have this Surgaflex Pellishield matrix that I can place in the wound bed. It's one product that does, prevents infection and also aids in wound healing. Easy to use and yeah, again, just convenient for me and the
Hmm.
patient.
Yeah, that was great. So before we talk about Academy, which is just a few weeks away, and what you all have planned there, I want to bring up one last important topic. So, Brad, when you're talking to surgeons about pain guard and how that supports the opioid-free protocols we're moving towards. What's their reaction?
The first reaction is, you guys put lidocaine in a product that can be absorbed right now, and that's going to help me with pain. I also think that a lot of people think about lidocaine within their practice, and they're like, yeah, it's just simple lidocaine. It's not going to do a whole lot. With it incorporated into our matrix, we're actually finding since our launch in September that patients are having longer successful pain management. We're seeing a reduction
Mm,
of narcotic use, and we're seeing a reduction in patient reported management of pain. And we're seeing providers who have been very excited about the outcomes for the first time. We've seen it both in the podiatry world, we've seen it in the burn arena, and we've seen it in the ortho trauma space. And so I think
mhm,
that all of those areas of focus are showing us very quickly here that the lidocaine mixed in with the matrix, and although it activates about 80% of it within 30 minutes, we know that we're seeing longer benefits of that management.
mm,
And I think that's something that we're going to try to highlight just a little bit more at the upcoming Academy on March 2nd. We have a
mhm.
really great event that's going to be there. We've got another one of Dr. Nilsson's providers throughout the United States here who's going to share some of his cases of pain guard and highlight really how those have benefited his patient population and ultimately benefited less narcotic use.
Yeah, very cool. I'm excited to see that. Very excited to see that.
It's a
Dr.
new
Nelson,
it's a new technology, right, TJ? It's something that
yeah,
we haven't seen on the market before,
of
and I think
course.
it's something that we're excited to see more engagement within the ortho community with, and something that we feel like is really going to make a benefit down the line here.
Hmm. Hmm. So, Dr. Nelson, you're not using Pain Guard, but is there anything that you want to comment on around how that could impact your practice when you start using it? Because it sounds like it's ran out. Like you can't get
Yes.
it. You can't use it right
Yes.
now.
And so when we brought Pain Guard into the hospital, some other surgeons got to it before I did.
Yeah.
But I'm really excited, especially for patients with, chronic wounds who are getting chronic, regular wound care or doing wound vac dressing changes, which can be extremely painful.
Yeah.
We've tried all sorts of things like shooting lidocaine in through the tubing to try to numb the
Hmm.
patient before we do their wound vac change. And this just seems so much simpler. So I can't wait to use it. Um,
Yeah.
yeah.
Very cool. So we are headed into Academy, the biggest ortho conference of the year, and it's a critical show for Embed. Brad, can you walk me through some of those main objectives? There's some data coming out. What else are you going to have at Academy this year?
Yeah, I appreciate the opportunity to come to Academy from a company that hasn't been there before. We're an entry level company. So when you look at the size of the Academy meeting, we're one of the small people over in the corner, right? We're one of those places that we really do feel like is benefiting and making a difference. So on Monday, we're starting the week very early with the opportunity for us to have a luncheon that's going to highlight three of our providers who are going to be sharing. One of those will be Dr. Himshoot from the Norton Healthcare System, who's going to highlight their 100 patient case study of use with our product. Dr. Nilsson's going to continue to highlight more of the cases that you've seen today, as well as others that she hasn't quite shared yet. We're going to dive into a few more video production pieces and showing people how we actually apply it in those settings. And then I think also we're going to emphasize the use of pain guard technology with Dr. Brigham Au, who's out of TMI Sports down in Texas, who's going to share how he's been benefiting that within his trauma cases as well. And I think all of those are reasons people should come and learn about the new technology, give us an
Mhm,
opportunity to understand how we're going to be competitive in this space, and how we know ultimately that we're pushing hard, getting to zero. And that's what
mhm.
all of our goals are, because ultimately that paves the way for best patient outcome. That getting to zero, reduction of SSI, helping your patients to recover efficiently and without infection is the name of the game.
So, for the surgeons who are watching this who want to learn more about using SAM in their cases, Brad, what's the best way to connect with you and the rest of the team at Embed?
Yeah, one, hopefully they've enjoyed this segment and getting to learn just a little bit more about our SAM technology and the ways that it can benefit their patients. We're going to flash up a code here that they can scan to be able to register for our lunch symposium on Monday, March 2nd in New Orleans at the annual Academy meeting. We also make sure that we share Dr. Nelson's email if anyone wants more of a peer-to-peer conversation with her so that they can connect and learn a little bit more about how she's benefiting, how her patients are benefiting from the use of the SAM technology. And then, of course, we'll have links to our website. And then, of course, the everlasting one from going to a show, we do have a booth. We will be present there, and we'll make sure we list out that information so that people can find us at the AAOS meeting. I know it's like walking around Costco and what that looks like. What could be more beneficial than to stop by and get your Listerine strip after you've been enjoying so many different meetings throughout the Academy? So stop by, see us at the booth, engage us. We'll be around. And again, we have 3 providers that are experts in using our technology. They're going to be present and more than happy to share how they're benefiting their patients with this technology.
Wonderful. So if there's one thing you want an orthopedic surgeon to take away from this conversation about SAM, about SSI prevention, about what Imbed is bringing to the operating room, what would it be?
Getting your patient to 0. No SSI infections on your patients and benefiting their pain outcomes postoperatively.
Wonderful. Well, Brad Wiggins from Imbed Biosciences, Dr. Karen Nelson from the University of Southern Nevada, thank you so much for joining me on this OTW Spotlight. To learn more about the SAM technology and Imbed's mission to get to 0 SSIs, you can visit embedbio.com and stop by their booth at Academy 2026. Thanks so much. Thanks for joining us on this episode of OTW Pod. For more insights and coverage on the latest in orthopedic innovation, visit ryortho.com. Don't forget to subscribe on YouTube, Spotify, or Apple Podcast, and we'll see you next time.